So we do a lot of shoulder injury management here. And so I use a simple cartoon diagram to show the anatomy and hopefully give you an example of what the injury pattern is. The bones of the shoulder, humerus bone is here. That's the arm bone. The scapula bone is the socket, and that's what makes up the glenoid, which is basically where that humerus sits. The next layer out is the rotator cuff. The rotator cuff is 4 muscles. You've got one that comes across the front, one that comes across the top, and 2 in the back. And each one of those rotator cuffs is made up of a muscle and tendon. Okay? Now, if we take the arm bone out and we look straight in, this is looking at the socket. The labrum, which is cartilage like the meniscus, is this O-ring that goes all the way around. And a key point there is where the bicep attaches. So you can see bicep injuries, you can see shoulder dislocations that can tear that labrum. The reason that's important is the shoulder is like a golf ball and a golf tee. This is a golf ball, and that's the golf tee. The labrum deepens the socket and helps hold the shoulder in place. If a patient or athlete suffers a dislocation, usually we have a labral tear, and now without that labrum, the shoulder becomes unstable. Okay? So moving back to the rotator cuff, the most common thing we see in clinic is rotator cuff inflammation or damage. And what happens is, again, this is the humerus, this is the acromion bone which makes the roof. In between those two is a fluid-filled sac called a bursa. So if you overdo things, that bursa gets inflamed, bursitis. If you keep going and you don't seek help, or you just kind of keep doing your activity, this tendon can get inflamed, tendonitis. And if you keep going and keep doing your activity, this can go to a rotator cuff tear. If that tendon tears off the bone, then sometimes we have to arthroscopically go in there and fix the tendon back. That's a rotator cuff repair. So that's normal shoulder anatomy, some examples of some injury patterns that we see every day here at Ortho Virginia. So if you think you have a shoulder injury, you want an explanation on your specific injury, let me know.